Molluscum contagiosum. Molluscum contagiosum, small grain infection. Number 1. Introduction to the disease.
Molluscum contagiosum is a viral skin disease caused by the Molluscum contagiosum virus, MCV.
This disease causes small, round, raised, and usually shiny spots on the skin with a slight pit or depression in the middle. The disease is usually harmless, but can be easily transmitted from one person to another. This disease is caused by a specific virus of the poxvirus family called Molluscum contagiosum virus. This virus multiplies in the upper layer of the skin, epidermis. This disease is contagious and spreads in the following ways: direct contact with the skin of an infected person, by using infected clothes, towels, bedding or personal items, by sharing water in swimming pools, sexual contact, in adults, close contact during play in children. Symptoms of Molluscum contagiosum disease. The main symptoms of Molluscum contagiosum are as follows: small, round, pale pink, white or waxy bumps on the skin, 2 to 5 mm in diameter, and a slight pit in the middle of the bumps. The bumps can be soft or slightly hard, usually painless, but may itch or burn. Most often found on the face, neck, arms, legs, abdomen or near the genitals. Which people are affected by this disease? Children, especially those aged 1 to 10 years, people with weakened immune systems, HIV, AIDS or cancer patients, people with eczema, people who regularly swim or have close physical contact. Bacterial infection in the pimples, worsening of eczema, rapid spread to different parts of the body. Precautions in this disease: keep affected skin covered. Do not share personal items, towels, clothing, etc. Use a separate towel while swimming. Prevent children from scratching or picking at the rash. Exercise caution in adult patients. Treatment. Molluscum contagiosum usually resolves on its own within 6 to 12 months, but treatment is needed if the rash is spreading, the patient is experiencing severe itching or irritation, cosmetic reasons. Treatment method for this disease.